So first of all, when you look at quality of life of patients with myeloma, and when you compare the different items with the quality of life you see in the general population, of course, there's a big gap. So myeloma patients have reduced quality of life, but the impact on an individual patient depends on the effectiveness of the disease, of the therapy. And if the patient is in complete remission, actually, he should regain his optimal quality of life, more or less, unless he has some, let's say, complications which don't resolve within short time, like neuropathy or so on. But the patient with relapsed refractory disease, which is not well controlled, has many problems. He suffers from fatigue, of course, physical impairment, depression, and of course, pain may be a very important issue in those patients. So you have to focus on all these issues and try to relieve the patient from his symptoms. But the most important, of course, step is to have an effective therapy to bring the patient in the best possible remission, and then many of the impairments will improve. But if the disease is not well controlled, then the patient is in trouble, and the care team is in trouble, because quality of life will be suboptimal. But with maintenance therapy, usually, for instance, with ixazomib, as you mentioned in our study, we saw a significant improvement in quality of life after stop of induction therapy. And when we started ixazomib maintenance therapy for 1 year, patients' quality of life improved significantly. So, of course, there's an impact of induction therapy, which is usually much more aggressive and leads to more side effects and more impairment of quality of life. But maintenance therapy, of course, for instance, with ixazomib, is quite well tolerated.